Obviously, this is our beautiful lobby, which is great because there's a lot of windows and a lot of light. It's always our goal not to have people waiting in the lobby for long, but if they have to, we think it's beautiful. We have 2 cat or smaller exam rooms here and here, and I can take you through this one if you'd like.
Okay.
So it has a fold down table, our exam table. Which we like to have that option, so we can do small dogs and cats on here, or we can also fold it up if we're to have larger patients in this room. And then if you come through here, we have radiology in here. We have a digital radiology, so we perform quite a few x-rays. We also have an ultrasound capability in there. And here's our cat ward for sick cats or cats that are getting surgery. And we're really fortunate that we actually have an oxygen cage. Not every practice is able to have that. So we feel really grateful that we have that for our patients that are dependent on oxygen. Back here is kind of our work area. So, drawing blood sometimes, examining patients, lots of supplies in here. And then that's our pharmacy. That's a technician station where we keep our medications and get things filled. Our little command center, our little board. On busy days, this thing just gets filled with patients and surgeries we're doing. And that's how we stay organized, make sure everyone gets what they need. And this is how we sometimes communicate with one another about clients that call back. And then, let's see here. This is our larger exam room. We love this room. It's quite large. So you can see in here, we have room for multi-pet families, large dogs, families with a lot of more than one human that want to come in. We have plenty of space in here. So this is our larger exam room. And here is our dental suite. So I know that Dr. Sims. Dr. Sims is big into dentistry. I love it as well, but it's one of her passions. So she does a lot of dentistry in here. We'll also do some what we call dirty surgeries or very infected things that we don't want to put in our clean OR. We'll do that here as well. And here's our lab station where we can run lab work. It's all the information includes like lab work and urine can give us on the animals. It's really helpful. So this is our lab machines. This is for blood work, and this is for urinalysis. Here's our dog ward, for dogs that are going to get surgery or are sick. So this is our what we call like the scrub area. So before surgery, Dr. Sims and I can scrub in here. It's one of those, it's not working. Oh, there we go. One of these like touch-up sinks for us to scrub. We have our autoclave back here, all of our sterile supplies. We're really lucky to have one of these pass-through windows to our OR. So we throw our sterile gloves, some suture. Sorry, that will stop. And then finally, in here is our beautiful operating room. So this is where a lot of the magic happens, all of our surgeries, and coming from the shelter where Dr. Sims and I both performed a lot of surgery is something that we're both really passionate about. So we feel fortunate to get to do a bunch of surgery here in private practice as well. And this is our OR. The only other thing we have to show is, actually that's not true, we have 2 things, almost. So our break room is here for our staff. We like to stock lots of snacks and coffee and things they might need. And then the other thing, I guess, is our grooming room. So we do offer medical grooming services for animals that are heavily matted. Hi, sir. He's a good boy. And so this is our grooming room, and we have a nice bath that has a pull-down ramp for dogs with limited mobility in here. And then the only section of the clinic that we didn't see was, our isolation ward. So we do have an isolation ward for infectious patients that's back there, and it's locked now, but luckily it's easy to access through our back door. So if we ever have an infectious patient, if we know in advance based on the clinical signs or anything, we'll actually have the client drive around back and walk directly into the and so we can avoid any contamination in our lobby. Of course, there are times that we don't know they're infectious till they come, and when that happens, we have a protocol for cleaning, and then we'll move the patient back to the isolation ward. So yeah, it's a pretty it's not the largest clinic, but it's really well designed. We got really fortunate because we're not the ones that designed it. The previous owner was, and yeah, it's beautiful. It's really fit our needs. So.
Great.
Is that any questions?